I've no idea what it is. Never heard about it, and
So I know a little bit about it and how it, affects the body and affects them. Yeah.
No, I've never heard of it. It's a blood disease, isn't it? It's something to do with the blood.
I have no idea what is it. Is it like in mental health?
Yeah. It's something to do with anemia.
Sickle cell disease is a lifelong genetic blood disorder, and it's inherited from parents. Either parent, both parents are traits, are carriers, and therefore the child inherits the full disorder, and it's lifelong treatment starting from 3 months old.
I know my dad had it, and it's about thinning of the blood, I think. Is it about having thin blood? And it's like a trait you can get. I'm not sure 100%.
Your red blood cells are sickle, so basically they obstruct your blood flow, and then you suffer like lack of oxygen and all that.
I know that if people have like the full version, it can be quite dangerous, obviously, if they get cuts, because obviously blood can't clot, and they won't stop bleeding.
One of my close friends got sickle cell, or two actually.
Yeah, they're in immense pain. The whole body's in pain, especially the bones. They're in a lot of pain, and sometimes they have to be hospitalised. Yeah, and then they get treated in hospital, and then they're fine maybe a couple of days later. But it can happen again where they go into spasms of pain again. It's just an ongoing thing for people that have got it.
Sickle cell patients report the pain as severe, excruciating. It can be pain anywhere within the body. Obviously, during a sickle cell crisis, the red blood cells take on a sickle cell shape and become stuck in the main arteries and veins and capillaries. That can happen anywhere in the body, so therefore it can happen in the brain, which could lead to a stroke. It can happen in any of the limbs. The patients are advised to take painkillers at home and try and self-manage as much as possible. But obviously, if the pain becomes too severe, they're advised to ring an ambulance or attend A&E for emergency treatment. The emergency treatment involves intravenous fluids and IV analgesia, which the drug of choice is morphine. Sometimes they require oxygen, sometimes they require top-up of a blood transfusion, and sometimes they may require a red cell exchange transfusion. It depends on the treatment pathway and how severe the sickle cell crisis is. Our role here at the centre is to avoid the patients coming into hospital where we can do by advising them on good self-care management, staying warm, having fluids, keeping, if they've got their environment, the housing should be warm, they shouldn't have any damp housing. They should try and avoid stressful situations if they can, and come to their clinic appointments quite regularly if they can as well, to monitor the condition, and if they're on certain therapies, to carry on taking that drug so it can have the maximum effect. The sickle cell disease can lead to problems with the major organs, so sometimes the heart, the kidneys, the liver. So monitoring the patients is a good way of us predicting which patients will have more problems. Also, it can affect the mobility, so quite a few of our patients have a condition called avascular necrosis, which means that it attacks the hips and they may need hip surgery in the future. So it is quite a debilitating condition over someone's life.
One of them undergoes quite a lot of medical complications because he has injuries that they don't heal on time, and he's quite depressed quite often because of the whole sickle cell thing.
Well, we know from research that a condition like sickle cell affects the quality of life of children and families. It has it's associated with increased psychological distress, and the types of problems we tend to see in the service in younger children are around behavioural problems. Younger children do tend to externalise their difficulties, so we see things like anger, temper tantrums, whereas in older children they tend to internalise their problems, so we see things like anxiety, depression. They often can feel very different to their peers, and we have lots of self-esteem issues.
On the individual, obviously, it's the unpredictability of the illness that they found most difficult, because they can be studying, they can be going on holiday, and they would just have a severe sickle cell crisis, and that's pain all over the body, and then end up going into hospital. So it can prevent them from planning day-to-day activities. The precipitating factors is very cold weather, stress, infections. They naturally have a lowered immunity. So there is a programme, an immunisation programme that we encourage them to have, and for the children, they're on daily antibiotics twice a day. So the impact, the physical impact on the patient is very real. It affects their studying, sometimes it can affect their general life, the work environment, having time off. So we at the centre, we're community-based, so we're here to support the patients in managing the self-care management at home to give them optimum outcomes and really to keep them out of hospital.
I don't think the general public are aware of it. A majority might be aware of it, but not the whole majority, because it's kind of just with the black community.
There's still this myth that it only affects black or Asian people, whereby we can actually find the traits in Caucasians and in other ethnicities. And obviously we've realised this now because we do universal screening. So we find people all the time where we've screened who are Caucasian who come back as traits. So we cannot just look at the colour of people's skin anymore and just assume they're a certain type. We totally have to go off the blood test. So therefore there is a bigger impact that people really need to know what's in the family. They need to have this awareness of having these carrier types.